And we are live.
Terrific. So good morning. This is Senate Health and Welfare Committee meeting of January 17th. This morning, we're going to take a little bit of time to begin, as I say sometimes, begin to launch to commence to go forth on prevention, because prevention is a huge concern in here and outside, in particular where mental health, substance use disorder, and other behaviors that interfere with our healthcare system and tend to keep people from being as healthy as they should. So, and I know that each of you has expressed an interest in one or more prevention effort in the state, and we will get to some of those. So there's a recent report out on obesity. There are reports out on tobacco, on PFAS and consumer products, prevention for mental health illness, and prevention for substance use disorders, including opioids. A few years ago, I'm going to just take a minute, if you don't mind, our chief prevention officer, and just talk historically, and then I know that you can fill in my gaps.
Absolutely.
Thank you, Michael. And so as long ago as 2001, we developed what's known as the Coalition for Healthy Activity, Motivation, and Prevention Programs in the state, where we worked with our American Heart Association, the Cancer Society, our local businesses, and others in an effort to promote health and wellness and prevent obesity. That was the initial, and heart disease. So that one went forward. It has become sort of diffuse, and greater interest has taken place in prevention overall. But the more we invest in prevention, the more we save later on in terms of chronic healthcare issues. And so just to walk up to last session, and Senator Hardy and I were here, and well, before we get to that last session, we did put in place a prevention council in the Department of Health, and when David is in, Englander is in, he can help bring us up to speed on what that council is doing. It's a cross-cutting council across state government and has a leader embedded in the Department of Health. And at the same time, we brought forward our wonderful chief prevention officer, who is here with us today. Last year, we had the benefit of the Attorney General's settlement for prescription opioids. And there was a huge settlement document that came out. And as I read it, decided that, the legislature needs to be involved in how do we spend $94 million or 84, whatever it is. So we did meet, Monica and I and others in the governor's office met and talked about how to put together a group, the advisory group that was embedded in the settlement, and Senator Hardy is on that advisory group, which is a good thing. And so that group is meeting and talking about how do we spend, $84 million over 15 years of prevention. I think we'll talk a little bit about that as well. But so that's happening. And then in addition, the AG has found another settlement for prescription drug overuse from the pharmaceutical companies. So additional funds will be coming to us, and I don't know how those will be sorted out. I haven't read that settlement yet. So there's a lot going on in terms of prevention. There are folks who believe that, and we each believe that each step of the way, prevention, intervention, treatment, and recovery, each of those stages is important, and we need to invest in each one. Today, we're just getting a step into some of the issues around prevention that our chief prevention officer is involved in. And I hope you'll also talk about S197, that little mental health. I don't know if you can, but we can pick that up another time. I forget what act it is. Anyway, okay. So thank you for allowing me to digress for a minute, but all of these issues are important. They will land on our table, and we're going to have to make decisions about how we want to handle the bills and the legislation that we see and give recommendation to the full Senate. So thank you for being here.
Thank you for having me.
Why don't we introduce ourselves for you, and then we'll have you introduce yourself for the record.
Sure.
Dave Weeks, Senator from Rutland County. Nice to meet you.
Martina Kulik, Senator from River Burlington from Chittenden Central. You know me, Ruth Hardy from Addison District. Good to see you too.
Terry Williams, Senator from Rutland District.
And I'm trying to remember, I think we live near each other.
We do, just around the corner from one another. Yes, I live in Williston. For the record, I'm Monica Hutt. I'm the Chief Prevention Officer for the state of Vermont. Just for your benefit and for this committee's benefit, I do have a little bit of a dual role because I sit in the governor's office, and I'll talk about that a little bit. I'm also the liaison for the governor to the Agency of Human Services. So as you know, every agency has a connection to the governor's office through a specific staff person. Kendall is over all of us, the one ring to rule them all kind of person. But each of us have a portfolio. And so for me, the Agency of Human Services is my connection. And that makes sense because I've been in this role for just a little bit under 2 years and spent the last 15 years at the Agency of Human Services, working in various departments, most recently as the Commissioner for the Department of Disabilities, Aging and Independent Living. So I have a lot of background in human services and was in the community at the Howard Center before that. So happy to talk human services whenever you'd like. But specifically today, to talk a little bit about my role, Senator Lyons asked me to, there's nothing on the screen behind me, right?
Not yet.
Okay.
Alex, do you want it on the screen?
I wasn't sure if I should sort of gesture or.
Alex?
I'm putting it up now.
Alex, can you get that? That's perfect. There it is. Your
Great.
PowerPoint is up there.
Great. Alice, could you go to the next slide, please?
Of course.
Thank you. So although the title of the testimony is specific to substance use and misuse prevention, Chair Lyons asked me to speak a little bit to my role, which she did just a little bit, but I can elaborate a little bit more, and to talk about the cannabis funding and the opioid settlement funding, because I think part of the conversation is how do we reinforce and focus on prevention, especially in light of all of the other pressures. And as Senator Lyons said, when you're thinking specific to substances, but it's true across many other issues, you're always looking at treatment and interventions and how to get people to the next step. And sometimes prevention gets short shrift when we're thinking about it because it just doesn't rise to the top when you've got a crisis in front of you. So just have that conversation a little bit with you. Go ahead, Alex, can you advance?
Do you tell me when you'd like the screen moved? It just moved.
Okay, perfect. So as Chairwoman Lyons said, the role of the Chief Prevention Officer was actually created in 2019. And I stepped into the role in 2020 at this point in time. And the act itself, although the initial drive, and I believe that the impetus was specific to substance use disorder and really looking at how we could prevent that. The legislature was very far-reaching and far-thinking as they created this position. And so they talked about things like chronic disease and health, and even really referenced kind of wellness. So rather than talking about prevention, how do we focus on wellness for Vermonters? And that's everything from housing and transportation and childcare, which I know you're going to be delving into, to substance use disorder and child welfare. All of the things, all of the social determinants that go into somebody's health and well-being or contribute negatively to someone's health and well-being. So the legislation is enormous, which is the most fun any job could be because it allows you and gives you the ability to think about things really broadly. It also can make you feel a little bit ineffective because how can one person solve all of those problems? But the beauty of it is that the Agency of Human Services, the Department of Education, the Agency of Education, all of our state agencies are working on prevention at some level. You know, everything from making sure that state parks are accessible and available to the work that we do in school and education, to the work that the Agency of Human Services is doing. State government is really all about making Vermonters as good and as healthy and as stable and vital as they want and can be. That's the role of all of ours. So it's easy to make the connections, even though again, the devil is in the details when it comes to the funding. So I have the luxury of being able to think about improving the well-being of all Vermonters all the time.
Can you talk very briefly, I don't know if you can do it later on, but about your perspective on the social determinants of health?
Absolutely.
Yeah, if you want to do that now.
I can do that right now, and if, actually, if you switch to the next slide,
Okay.
this is, this keeps getting longer. This is the document that I use for myself, the way that I sort of define the role for myself, and I just keep adding to it. And I will also just say, because I started life as an English teacher, there is an error in there. In the last paragraph, it's supposed to be critical activity. And as soon as I saw it, I thought, oh, shoot, I hate when I make mistakes like that. But, and of course I feel compelled to call myself out because, you know, once an English teacher, always an English teacher.
As an English teacher, I appreciate that.
Did my student teaching experience.
Thesis advisor, I appreciate that.
So social determinants of health, and what does that mean? People talk about that and act like we all know that, but really the social determinants of health are basically all the inputs into our lives, right? So what does transportation look like? What does our housing look like? Where does our water come from? What kind of childcare are we able to offer? Where are our kids going to school? You know, what are we able to access in terms of either exercise to keep us healthy or therapy if we're, or somebody to talk with if we're feeling distressed. What's our friend network look like? What are the relationships in our lives that make us happy and keep us well? And I don't mean to sound Pollyanna, but what we really have come to understand scientifically and data-wise is that all those things contribute to our physical health and our mental health, and actually create this whole package. And it makes a difference. And you know, that got really clear to me. I have to say that the time that I spent, and Senator Lyons has heard me say this a million times, but the time that I spent at the Department of Disabilities, Aging and Independent Living and thinking about wellness as we get older, you know, and watching my parents age and watching the kind of the impact of hearing and hearing loss on your mental and physical health as you get older, on your balance and your core strength in terms of whether you fall and break a hip or don't fall and break a hip. All of those things go all the way back to how you are as a child, and the inputs that come in there is your food, nutrition. You know, is your food nutritional? Does it keep you healthy? Does it get you strong? Are you accessing the medical care that you need? A lot of people don't have the resources or even the time, even if they have insurance, to get to the doctor for the preventative stuff. So they go when they're sick. And the doctor tells you all the things that you should have been doing to prevent being sick. And you think, well, yep, I could have done all those things, but I didn't have the time, or I couldn't get off work, or I had to balance, you know, all of my family obligations. And so, no, I don't exercise 30 minutes a day, even though I'm supposed to. We know that that's the right thing to do, but trying to get to that. And one of the, and I'll talk about it a little bit more when I get to it, and I already can hear myself talking faster because I get very energized about this.
We have time.
I know, I do that when I
You
get
have
tired.
David's time, so you're
I
fine.
got David's time, so I can just do whatever I'd like. One of the things that, one of the coalitions that I sit on is the Health Equity Advisory Commission, and we'll talk about that a little bit more. But again, looking at health and well-being and the inequities for certain populations in our state is another kind of component. So those social determinants of health are essentially the environment around you, both your personal environment and your physical environment, and how it contributes to your health and well-being. And I can certainly give you lots more information about that. I suspect that as a committee, this is something you're very familiar with, but I found some really great basic information, because even when you're doing it every day, sometimes it gets to be really overwhelming when you use phrases over and over again. You know, you say a word again and again and again, and all of a sudden you don't even really know what it means. Social determinants of health is kind of like that.
That's one of the, that's why I asked you to just
Yeah.
elaborate a little bit. Thank you for doing it.
Yeah, and I'll send you, I found a couple of really simple definitions. I have one taped above my desk, because it helps me to be a little bit simpler, because as you hear, I get a little verbose and expansive in my thinking. So this is a great description of the work And actually, Senator, one of the things that you had asked me to speak to was the difference between my role as the Chief Prevention Officer and the difference with the role of the Chief Violence Prevention Officer.
Oh, thank you for doing that. Yes.
Yeah, so Dee has come into state government most recently, and she would be delighted, I'm sure, to come in and testify. She's very operational in her focus on violence prevention. She's doing a tremendous amount of work in school, around school safety and preventing violence there, but also looking across our communities. And I am very cognizant of our two senators from Rutland, where Project Vision was born and took root. And that was another kind of a violence prevention, social determinants of health combination where people across Rutland County were really looking at, well, Rutland City, I guess, not Rutland County, but in Rutland, we're really looking at the link between violence and crime and our social service system and how we could bring those two together to be preventative. So I know that actually that Project Vision is being, maybe revitalized is the wrong word, but I know some new leadership is coming in. And Dee could speak to that a little bit more, but I think that that's really where her focus. She's looking at the nexus of crime and public safety and some of the human services work. And she and I have been working very closely together. She's a little bit more operational, and I have the luxury of being a little bit more the connective tissue across all of the good work that's already happening in state government. So just to speak to that.
Thank you. That was helpful.
Good, and she would be delighted to come in actually,
Yeah.
so.
We may do that. There is a bill in, I think, I'm not sure where I was going to go, probably land in judiciary, but we'll be having joint meetings with Judiciary Committee, and that's the time to have her, maybe we'll have her come in here before that, or maybe I'll talk with the senator from Bennington about putting together her testimony.
Yeah, absolutely. So I'm not gonna read through all of this. You've got it in front of you and you can look through it, but I do think that the very last sentence is core to the conversation, and this is something that I know Senator Hardy has heard a lot as we're talking about it on the opioid settlement advisory council. How do you prioritize prevention? Where do you put it in the framework? And in a very real way, how do you fund it and not feel as if you're taking away from areas that need immediate attention? I think that that's the age-old conversation around prevention. And I've spent most of my time in my life really looking at interventions and treatments, the things that happen when something has already gone wrong. So I think trying to think about how we put it into place, but also recognizing that it's not, the health department has a way of talking about prevention where they talk about primary prevention and then secondary and then tertiary. And primary is really that educational work. But the reality is that pretty much everything that we do, when we fund a housing program, when we support childcare, when we talk about after-school funding, those are all preventative. And that's how I would love for people to talk about it, really recognizing that the work that we're doing has a component of prevention, and we don't have to be purists when we're talking about prevention. We have to recognize when we're investing in things that are preventative, whether that's preventative healthcare or preventative supports for kids and families. We're always trying to get ahead of the curve, and most of the interventions that we're funding are prevention, and that's very true, especially when we're talking about substance use disorder and thinking about folks who cycle through, with a substance use disorder. It's not atypical for somebody to relapse multiple times before they can truly be stable in their recovery. And that's part of the disease, like with any other disease. So preventing every single time, preventing overdose deaths is a part of prevention as well. I tend not to want to separate it because it makes people feel like one thing is fighting against the other, and that's not our intention, I don't think.
But measuring outcomes is also kind of
Critical,
touchy, but critical.
but absolutely
Difficult, I
critical.
should say.
Because even the bad outcomes tell you something.
Yeah.
Right? I think we have this fear of measuring because we think it's going to show us something isn't working. But frankly, learning that something isn't working is exactly what you need to do to make it work. If all of our outcome measurements were just successful, then I'm not sure what we would be doing with ourselves.
So, please,
No, go ahead, Senator.
does your program monitor metrics, trends and such? Is that something you
So-
intend to offer?
Every program in state government, so I don't have a program per se, I work with all of the existing programs, and every program in state government should be monitoring outcomes, measures, metrics. Many, many moons ago, we adopted as a state this idea of results-based accountability, which is one of the ways that we monitor metrics. There are lots of other ways, but that's the one that I love because it's really simple to understand.
So I haven't looked forward into your presentation, but are those types of metrics embedded in this presentation, or is that something that follows on?
No, I don't have them in here, but if we wanted to talk specifically about any program in state government, I could make sure that you got and we're able to look at some of the metrics. The Agency of Human Services in particular has a really beautiful dashboard, and I will send you the link to that just so that you can find it.
The Department of Health, when they come in, perhaps that's a question we'll add to their presentation.
Yeah, they would be happy to talk about that.
Can you send the link to all of us?
Oh, absolutely. I'll send it to Alex and then he can get it to the. group.
Yes, yeah, that's the best way to do it.
And so AHS has an overall dashboard, and then each of the departments also has a dashboard, and so you can see what they're measuring. Also, you must be getting inundated right now with annual reports from everybody. And each of those should also have, I know for the Agency of Human Services specifically, we tend to embed all of our outcomes and measures in those annual reports. And as you're getting your introductions, I absolutely ask those questions because we should be measuring. We are measuring. Could we measure different things? Maybe, and that's something always to talk about and think about because it shouldn't be static, right? I'm not sure that was a very non-answer to your question, but.
You told me.
Okay. Is there another question?
I do have a question about prevention in terms of the opioid epidemic. Am I correct in saying that part of, at least partially, the opioid epidemic was caused by pharmaceuticals, by prescription drugs?
Overprescribing.
Okay.
Yeah.
And that has been dealt with, at least partially, with legislation, correct? So that that can't happen again?
Yes, there's a prescription, there's a Vermont, I can't remember the acronym, but there's essentially a prescription management system
Okay.
that doctors have to weigh into. And you may have even seen it in any visits to the ER for yourselves or family or friends where the doctor's much more cautious about what they're going to prescribe and what they're going to send you home with.
Okay. I just.
Yeah, there's also a prescription drug detailing group that is centered at the medical school at UVM. And so when we look over the program and the detailing that goes on, it's not just the docs, then it's also the drug companies that have really pushed their product. And we know in some, with the AG settlement, had some of the unscrupulous things that have happened. So that's a whole.
Right, it's a
Yeah.
whole, it seems like a tragedy that should never have happened and should never happen again. And I just hope that, you know, it's almost like we have to protect ourselves from ourselves in this case, and because the system really failed us. And I just hope that in terms of like prevention, that folks really have their eye on holding those folks accountable and making sure it doesn't happen again.
Yeah, and I think that there actually are metrics and measures for the rate of prescribing, the amount of prescribing that are embedded in that. I keep wanting to say it's BPM, but that's probably not right. The Vermont.
I forget what it's called, but it is. I remember the Vermont writing it. Senator, how do you want to make a comment?
Yeah, and I also have a question. Or
Sure, go
should I
ahead.
wait till?
Yeah, see what, wait, if it's something coming up, then hold it, but.
Well, so just there is still work to be done in that area because as more drugs come onto the market, and we're also seeing different types of drugs that are, for example, right now there's a veterinary drug that's one of the major problems. So yeah, and so that's sort of outside of the system right now. So it has been it hasn't been solved fully, I would say. It's still an ongoing thing that we need to, that the whole medical community broadly, defined needs to stay with. I have a question for you, but I think I will let you finish and then I want to
Sure.
ask.
Sure, and actually, just to add to the conversation about prescription drugs, so I think that you're absolutely right, Senator, that initially it's making sure that the prescribing is happening. But there are a lot of other steps after that too, so education around drug disposal, around getting rid of it when you're not using it anymore, giving it back, not letting it sit in your medicine cabinets, is a whole nother part of making sure that
Pharmacist and what role
addressing
that
that.
pharmacist plays, we still
Correct.
have to look at that.
Making sure that
Yeah.
kids don't get hold of things or that you're not, using it for some other purpose later on. And again, based on the work that I did at Dale, at the Department of Disabilities, Aging and Independent Living, realizing that for older Vermonters, oh shoot, I can think of the word, using a prescription drug and combining it with other things changes as your body gets older, your physiology changes and you don't actually metabolize in the same way. So certain drugs that may have been prescribed to you and a glass of wine at dinner aren't going to have the same effect that they did when you were much younger. And so trying to really pay attention to prevention all across the lifespan so that we aren't creating problems even later in life because people are just following the directions of their doctors or not necessarily thinking about or sharing information. Again, it's one of those things that the doctor says, are you telling them everything that you're doing or are you fibbing about, sometimes you maybe exercise more and have less of a glass of wine at dinner when I'm talking to my doctor than might be actual truth. So realizing that it's important to say those things and making sure that that's also part of our messaging and marketing because our bodies are changing and things happen differently depending on what's going on. So the prescription piece is huge. When I get off this page, so I'll just keep talking about it. So the next slide just very quickly, and there are so many people that I wasn't able to list, but so many partnerships that I am able to have across state government. So, thinking about the obvious suspects, so the Vermont Department of Health and the Department for Children and Families, the Department of Mental Health and the Department of Disabilities, Aging and Independent Living, but also working with our Medicaid group, the DVA, the Department for Vermont Health Access. I've had the opportunity to work over the last couple of years with the Agency of Natural Resources when we think about conservation camps and our after-school programs. The Department of Liquor and Lottery, as we talk a little bit more about the cannabis funds and trying to make sure that we are approaching cannabis and then thinking about sports betting, whether or not that becomes something that is legal here in Vermont. How do we create prevention strategies around that before we launch it? I will say, and I'll talk a little bit more about it, regardless of how you may feel about the legalization of adult use cannabis, Vermont is doing a really good job of moving very slowly, very methodically, very thoughtfully, and trying to build safety strategies around it. It is complicated. It's complex, I think, when thinking about it. But I think that Vermont, I was in Portland, Oregon a few years ago, and I feel like Oregon didn't do a very good job with their legalization efforts. And it was, I thought, a really great example of how not to do it in terms of how many retail establishments were available, the licensing regulations, which seemed really less thorough than they could have been. And I think Vermont is really working hard to do that. And I think that the legislature has been really engaged and involved in every little decision. And I think that that's critical because we don't want to create problems.
We've learned a lot from the other states' mistakes.
We have.
Yes.
And we continue to.
Yeah.
So there certainly will be some more things that you will see, I think, as a legislature this session come up. Because there's always going to be pressures and pushing. So considering how we can continue to center prevention for youth in that conversation about what's appropriate and not appropriate for adults, two very different populations that we need to think about separately. So also working a little bit with the Department of Financial Regulation, very much and very often with the Agency of Education, and even the Department of Public Safety when we think of, or not public safety, but the Department a public service, because even when we're talking about things like weatherization for older homes, another area of prevention when you think about safety for older low-income Vermonters. Lots of community organizations and different coalitions that I sit on as an executive member or as a member. So the Substance Misuse Prevention Council is a group that I do sit on. The Health Equity Advisory Commission, I talked to you about that a little bit earlier, really thinking about the disparate impacts on health for certain populations. And Vermont's legislation goes beyond race and ethnicity and asks us to look at the impacts of health or the poor health outcomes for Vermonters who are LGBTQ, for Vermonters with disabilities, even for older Vermonters. So really trying to look at why are our health outcomes for those populations, including those individuals who are Black, Indigenous, or people of color, why does the data show us that they are less healthy than they should be here in this really amazing state? And so looking at all of those populations. The Opioid Settlement Advisory Committee, as we spoke to Senator, and Senator Hardy is a member of that as well. And also the Vermont Interagency After School Task Force. So those are some of the key coalitions and committees that I work with or lead on.
And then there are others that have been in existence for a long time. I'm thinking about the kids tobacco program that's been going on, that, and which was extremely effective with tobacco settlement funding, and then the tobacco settlement funding has sort of gone down, and the outcomes have decreased. So, you know, it's a constant effort. Whatever you let go, gaps show
Yes,
up.
and the local prevention coalition, so that first group of
Yes.
the community, those local prevention coalitions exist across the state of Vermont. There is a coalition connected to every community. In last legislative session, the legislature approved $3 million in prevention funding specifically to go to those local prevention coalitions to really entrench and enhance the work that they're able to do. The way that any local coalition like that works, they kind of pop up and then die out depending on what funding they're able to get. And so the intent of that $3 million was to stabilize those networks, to create those coalitions, to create a network, you know, in every community, one coalition that would be stabilized in terms of its operational costs, so that it could then look for grants, but not always be looking for survival dollars, which is how any, you know, really tiny organization like that tends to work. And so those dollars were one time last year. We need to look to see what will happen in this year, but eventually they will be funded with the cannabis revenue. I'm going to talk about that in just a minute. So, and I know that Senator Westman and Representative No, I'm thinking of his first name and I can't remember his last, and so I don't want to.
Oh.
It's from Rutland.
Collmore.
No.
Representative.
Oh, representative. Oh,
Not, no,
Fagan.
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 I was getting there, I was gonna get this.
I had his first name in my head, I couldn't think of his last name. Representative Fagan and Senator Westman were really clear that they wanted to see those local prevention coalitions focusing on all substances. So not just tobacco or just cannabis or
Yeah.
just opioids, but recognizing that when you're talking about that primary prevention and education, both for kids and for adults in a community, that you need to look across substances because one is often connected to another. And some of the strategies are the same and some are different depending on the substance, but to kind of silo tobacco from cannabis, from opioids is probably doesn't make sense when you're trying to really get at how are you trying to prevent initial use. And that's really what these coalitions do. We've got lots of other programs that have been picked up along the rest of the continuum.
Does alcohol get put in there as well?
Absolutely, yes, absolutely. So just to talk to you a little bit about
Next slide,
cannabis.
please.
Thank you. So I referenced this a little bit, the cannabis sales tax revenue. So Act 164 made adult use cannabis legal in the state of Vermont. Just as a side note, I tend never to say recreational use just because I feel like that's a really funny message, especially when you're trying to talk with kids. That makes it sound really fun. And again, it's a choice, but it's a choice that adults can make, like with alcohol, like with tobacco. It's a choice for adults to make. For kids, we don't want to talk about recreational. So I always talk about adult use to just be super clear in my language. So it made adult use cannabis legal in the state of Vermont. That law went into effect without the governor's signature And he was very clear that one of the key components was that if there was going to be revenue gained from this sales of cannabis across the state of Vermont, that one of the primary areas of focus needed to be prevention. So we're still waiting for the market really just opened up. I believe in October is when the licenses for retail establishments started being issued. I encourage you to talk with JFO about the projections for it because they've been working really closely with the Cannabis Control Board and with the consultant that was working with the Cannabis Control Board to try to get to consensus on what do they expect the dollars to look like coming in from both sales tax and excise tax.
So we will be doing that, and just so folks know, there is language in statute around prevention. It's just that it isn't significantly defined, so that's going to be a role that we play in defining how to use those funds. And last year, the statute was changed so that the money that was available for prevention, which was a big deal to us in here. We worked very hard to ensure there was language in that bill for prevention purposes. But what happened was after all expenses, then, or all costs, then what's left over is prevention. So originally we had 10% of revenue. Now we don't know how that's been dropped down. It is concerning because we will need a lot of resources for, as you pointed out, across the board. It's not one, many. So we'll be looking at that a little bit as we get more data on fiscal.
Yeah, actually, you switch to the next slide. It speaks to exactly what you just said, Senator, on that next slide.
Oh, good.
Yes, so
I'm
there's,
sorry, I didn't
no,
know
that's
that.
okay.
I
No,
should've
you're
looked ahead.
reading my mind.
There it is.
There's a sales tax and an excise tax. And
Yeah.
the excise tax is actually 14%. And 70% of that goes to the general fund and 30% actually to substance misuse and prevention. But you are correct, there was legislation last session that flipped the order of operations essentially. So initially it was meant to be 30% of the excise tax off the top would go to substance misuse prevention. And it has flipped now so that first the funding of the Cannabis Control Board and its operational costs are funded from the excise tax. And then the remaining amount, 30% of that goes to substance misuse prevention. It's not nothing. I'm not at all trying to sound stingy or as if I don't want the board to exist. I think it has a really important role in terms of regulating this entire huge body of work and in the licensing and the ensuring adherence to law. I mean, they have a big role to play, but I hate to see any money not be dedicated where it was. And that actually will sunset in a couple of years. And we're still waiting to see what the dollars look like. 6%, the entirety of the sales tax is actually dedicated to after school and summer programming. So that's really exciting. And again, as I said earlier, prevention not having to be named prevention in order to be preventative, we know how important after school and summer programming for kids is and how preventative it is in their lives. And so this is another form of prevention. It just looks a little bit different and is far more active, which is exciting. And the next slide talks just a little bit about the opioid settlement fund. And again, you always hate to try to talk about something when somebody's in the room that knows as much about it as you do. But the opioid settlement fund is specific to dollars that are garnered from settlements that the AG's office, the Attorney General's office negotiated. It started with 3 settlements, and I actually think we may be up to 5.
Yeah, is that what it is now? Okay.
Yeah, they keep coming. So there were these original 3 settlements with distributors of opioids, with the pharmaceutical companies, and actually with the Sackler family.
That's the one that.
Right, and we structured, the Attorney General's office was prescient in their structuring of the settlement because it essentially is absorbing any new settlements that come our way into the structure that we created for the original 3. David Englander from the Vermont Department of Health will be able to tell you a little bit more about the actual dollars because we're kind of waiting. They're held with there's a single individual nationally that's managing all of these settlements for all of the states in terms of the money coming in and then distributed out the states. And in the legislation, last session, I guess, the same legislation that created the opioid settlement advisory committee created a process by which the Vermont Department of Health would work with the advisory committee to come up with recommendations. Those recommendations would go to the governor. It would move through the governor's recommended budget so that the entire legislature could weigh in. So we've got a process by which everybody will be able to weigh in on the recommendations that are made through the Settlement Advisory Council in terms of how we spend the dollars. And Senator Hardy can attest to the fact that even now we're having these conversations about prevention versus treatment or intervention versus recognizing there are dollars to be spent and we can pick and choose the places that we put it to create a real continuum so that we're not leaving anything behind. It's 18 years of funding. So it's a really substantial amount of time and it's a pretty substantial amount of money. I think in the first few years, it'll be 3 or 4 million, but then it starts to accrue and become cumulative. And so there will be money to be spent on mitigation of the opioid epidemic. It also has, the settlement itself has probably 4 or 5 pages of allowable uses. They're broad, you can find lots of things in there, but they are prescribed. And so that's really the work of the advisory committee is to kind of sort through recommendations coming in and where might they fit and what are we going to prioritize.
One of the things that is clear in all of that is that the towns that were first a part of the lawsuit, so there were 5 towns, I think, I can't remember what they all are. But anyway, so there is some local funding available. So that becomes an issue for VLCT. I think they're also on the advisory board.
They are.
So how that local funding gets distributed, and then we don't want to have double dipping, triple dipping, overlapping initiatives. So, which is why that advisory committee is so really important for the executive branch as well as for us. Yeah. Ruth, did you want to?
Well, are you done? Because I wanted to speak
I
a
am
little
done.
bit about the
No,
opioid
please do.
settlement fund. And I know you've been attending those meetings, or at least some of them, because I've seen you on
Yes, I think there needs
thing.
to be a person, since easier to get in there.
Yeah, I was glad we finally met in person last time. I was the one that pushed for that because I couldn't even see who was there on Teams.
That little tiny.
Yeah, well, especially Teams, because we're all used to Zoom, so Teams for us is just, it's hard.
Yeah.
Anyway, so, I mean, I know you mentioned it, but the tension is between prevention and treatment. And I will just, I'm curious what you started to talk about it a little bit with the primary, secondary, and tertiary treatment. But I would love to hear you dig into that a little bit more, because I think that this, you know, the last meeting we looked at the Johns Hopkins principles of using the opioid settlement funds. These are 5 principles about how to use the funds. And the first one is to save lives. Like literally people are dying every day,
Yes.
every week in our state. And they are dying because they got addicted to these drugs because of bad practices from pharmaceutical companies and others. And in so many communities, every single person knows somebody who's died. It's tragic. And I feel really strongly that we have to use these monies first and foremost to save lives now, not long-term prevention, but saving lives right now. And I also think that saving those lives right now is prevention. And that's what I would love to hear you embed more in your conversation about prevention. I mean, particularly when you think about people as part of a family or part of a community, if you're saving that person's life, you are also preventing somebody else the tragedy and the harm of losing a loved one, a mother, a father, a brother, a sister, whatever, a niece, a nephew, a friend, you know, so yeah, a child. And so I think that there needs to be more talk about prevention as saving lives right now, not
Absolutely.
saving lives down 15 years because we've taught a kindergartner not to smoke or whatever. But because we've saved a mom's life right now, we are preventing a child from having a tragic life.
And I couldn't agree with you more. I think when I talk about prevention, I also talk about preventing overdose deaths, and that is prevention. Especially with substance use disorder, I think maybe even more so than any other issue I've really looked at. I feel like there are many different points along the continuum from when you might start to use and become, and then become addicted or end up with a substance use disorder through your treatment, through your interventions, through your recovery. There are multiple points where you can prevent. It's almost like just because we were talking about the interstate, sort of an exit ramp on the interstate, right? There are lots of places where those ramps have to be inserted so that you can get off that linear line, right? And I think every one of those, if you can help somebody do that, that's prevention. It's preventative. I totally believe that. What I worry about, Senator Hardy, is that we end up talking about it like it's completely bifurcated, like we must save lives now, we cannot talk about prevention. I think it's yes and, it's absolutely both. Somebody used the analogy last year and it really stuck in my head of a house that was on fire and we have to save the people that are in the house. Absolutely, no argument. There's 110%, but I also don't want anybody walking in the back door of that burning house. So how do we do both? And is this the opportunity with this? This is a lot of money that the state is going to see. How do we figure out how to use it so that we are really trying to achieve both ends and not lose for winning, not sort of save lives now, but create problems down the road.
I totally hear you. And I think especially in the first few years of the settlement funds, we have to put the fire out in the house. That has to be, especially because there are a lot of other funding sources for sort of primary prevention that are already dedicated to opioid prevention and other substance use prevention. Yeah. And we can't use the opioid settlement funds to displace other funds. So that's actually in the legislation. It has to be additional. It can't supplant. And so
new use.
And there are
or expansion of existing uses.
Yeah, there are so many right now needs for primary harm reduction treatment of people who are addicted to substances, to opioids. That the yes and I agree, but it has to be the yes first. And that's where I'm hearing from the administration, they're more on the and than the yes.
We'll get there. I think this is a good discussion. This is the kind of thing that we'll be bringing up as we go through any of our recommendations for budget, for sure. And then listening to what comes to us from the settlement, because it will come here eventually.
And it's interesting too, because the settlement dollars really do have to have a nexus to opioids. That's one of the prohibitions.
Absolutely.
So you have to be able to make that connection.
Yeah.
But I would just, I am not aware of a lot of other dollars other than that 3 million going to primary prevention and money at the Agency of Education for work in schools. There's not a lot of other money going to primary prevention, and that might be totally appropriate. But if there are other funding sources that you're aware of, I'm not, so maybe I need to just.
We'll get the Department of Health in.
I would love to.
We
just
had
hear that.
our meeting in I think October, maybe September.
It was one I missed.
There was a whole slate of like a hour-long presentation by the Department of Health of all the bazillions of little tiny pots of money they have.
Okay.
And a lot of it was going to prevention,
Okay.
broadly defined.
Yes, right, go back to the bigger
yeah.
definition.
Yeah, so we'll come back to this. We'll ask if you have the message here, Department of Health, it would be great to know primary, secondary, tertiary. How does it sugar off within the department?
Yeah.
We've got David to bring that in.
He can definitely talk about that.
Yeah, so, and then as you're talking about this, obviously, the prevention extends into recovery. And how long does it take to recover, right? Preventing you from going back. So how many slips, 5, 7, 9, we hear about people who are in recovery for years.
Yeah.
So having funds available to ensure recovery can be completed, that's a part of prevention. That saves lives. So
Absolutely.
it all gets down to what we understand and know about addiction overall. And you know, I think back to my professional experience when I had a grant from ADAD, when it was ADAD, about working with a friend in social work to develop the first integrated course on we didn't call it substance use disorder, we call it drugs, okay, and abuse. So we built that course and it spread across the universities and colleges in the state, and it's now completely different, you know. So when we talked about intervention, we were talking about the mother who showed up at school to pick up her child and she smelled of alcohol, and what do we do as a teacher or as, you know, or another parent? So it's changed radically.
And it's science, right? So that will continue to change. I also think, just speaking to what Senator Hardy was bringing up, you know, if you save a life and a family remains intact because you've saved a life, that's preventative for the children in that family, right?
Exactly.
Because they've got parents and they've got a more stable
All
family.
important.
It's all so connected. I think it's just important to, and we have to make decisions, but it's important to resist the urge to pit one part of the spectrum against the other, because we do that at our own peril, I think.
Yeah.
So trying to think about it more as a continuum, which is much harder to hold in your head,
Yeah.
frankly. I've struggled with it, but it's fun. And then another area that I know you're really interested in, Senator, is the co-occurring mental health and substance use
Yes.
disorder issues. And so really trying to dig into that a little bit, another area where prevention and wellness and health can be so impactful, and to, again, ignore it and not address it just creates problems that you can't, a fire that you can't put out, because then you're
We'll
just
probably
lost.
see a bill related to that for the blueprint. We're looking at that, working with the administration on that, as well as healthcare. So we'll see what happens, where that lands, but you're right, it's critically.
So that was, I think the last slide is just me saying thank you and making sure that you have my contact information. So,
There you are. Well, no,
thank
it's been-
you.
it's been great. Questions for, while we have her here?
Yes. Or things you'd like to learn more about, and I can direct you to the actual experts. I'm still absorbing as I go, but
The budget summary, which you alluded to a few minutes ago, would be fascinating to understand, you know, where the buckets of money are that or
we
at least
probably get that.
directly or indirectly related to prevention and such.
Well, the budget summary I mentioned was specific to substance use disorder,
Okay, that's
treatment and
good.
prevention. And I'm sure David Englander has that, or.
We'll ask him to bring it in.
Commissioner of
Yeah.
Health. And just so you know, the timeline on the opioid settlement committee is not well aligned with the budget process. So I don't know what the governor is gonna have in it. Obviously, I don't know what he's gonna have in his budget on Friday, what he's gonna say about it. But the settlement committee has not made recommendations yet to the governor or obviously to us, but I'm hoping that we do it at our next meeting, which is probably early February.
That'd be good.
But
Do you know what, I'm trying to remember what the timeline for actually getting the money is. We
We
got,
have some now.
we
Yeah,
have, how
we
much
have
have we got?
some.
And David can speak to that.
Yeah, okay, so we'll try to put that together. That might be a good thing to talk about legislatively, to try and fix that timeline if we can.
Yeah, the process will work beautifully for not this coming fiscal year, but the fiscal
The
year
following
after.
fiscal year.
But this one is tight.
yeah, it is tight, but we should still be able to get it into the budget. Yeah, it's just gonna not come with the governor's budget. It will be a little later.
The original settlement, I think, would allow for the executive branch to make all the decisions. So the statute that we put in place put some interaction between executive branch and legislature, which for me was critically important. So Yeah, so.
And the administration was supportive of that. It just
Yeah, no, I
creates this
understand
weird,
that.
funny
That-
timeline for this year.
It'll sort out. It'll soon enough sort out. We'll get there, but we'll keep an eye on it.
I am, as you might expect, Madam Chair, constantly saying, we gotta move faster.
Those poor people. No, this is great. Thank you.
You're welcome. So I want to make sure I remember the things that I promised. I was going to send you or send to Alex a link to the AHS dashboard. Maybe get you a little bit of information on the Vermont prescription monitoring system and some of the outcome data there. And then let David Englander know that when he's healthy and well and he's back in the committee, you wanted to speak to the presentation on funding in the name of the division is changed, so the Division of Substance Use Programs. Funding
Yes.
presentation. Was there anything else that you wanted David to speak to that I can just give you a heads up about?
The primary, secondary, tertiary funding piece, that would be important. And, that can be something that we post, whatever he doesn't have to speak specifically to every single thing, but just knowing that it's accessible for us and Alex can post whatever we need.
Okay.
Because there's a lot of interest in here, I think, at all, this whole area. We spend time, whatever bill we look at is part of this discussion.
All right, I will get all of that to you and ask David to be prepared.
Thank you so much. Alex, I think we can go offline. We're good, but we're not adjourned yet. But we'll just adjourn briefly tomorrow. Just I want a heads up before we go offline. You're
I'm
fine.
done.
Thank you.
Thank you.
Tomorrow, we have the report, the formal report on the financing study. Alex will be sending along a link to the joint fiscal office where the report is going to be housed in the joint fiscal office so that it's easier to make corrections and add new drafts. So it'll be that one place. So you'll become familiar with linking up to that. Spend some time looking through the report. We are very fortunate tomorrow morning. We'll meet here. We'll have House Human Services with us on Zoom, and the experts from RAND will come in and go through the report. And then the second hour, I should look at my agenda so I don't mess it up. Mess up the time. From 9 o'clock to 10 o'clock, we'll have that joint meeting. And then at 10 o'clock, they will come into our committee. We'll probably take a little break in there between Zoom and they'll come into the committee here and be with us. And then they'll go off to the House folks. In the afternoon, if you're on approach or finance, they're gonna do the same thing. I'm gonna get double shot, which is good. We all need a little bit extra. So, and so they'll be talking about the bill, and then on Thursday, we'll have a committee discussion, we'll have an opportunity, and we'll meet with those folks yet again, hopefully. So it's a big report. I read the draft early on, and now I'm making my way through the final. It's about 100 pages long. Don't be petrified. There are a lot of need in the state to get to a place where we have comprehensive childcare support, where those childcare centers are fully supported, where families are supported, and where businesses then can rely on workforce when kids are being cared for. A lot of the report is based on federal poverty levels. And so up to 350%, so I use the 300%, where we currently have our child care financial assistance program. And then the report shows how things might move ahead to 400%. So, and then how it would all be financed. Our decision in here will be on policies related to childcare, how it's administered, the governance structure, what we see as critical and important for supporting the administration through IT, what's critical and important for supporting families, for supporting childcare centers, and any discussion on licensure. So a lot of policies that then will contribute to the discussion about funding. So it's going to feel like we're in the middle of they call it sausage making. This is the time, when we start talking about childcare, when the bill is introduced, how it all fits together. So please enjoy reading that. This became such a critical issue for businesses and families during COVID. The report itself is based on 2018, 2019 data, because that's the last full year of data before COVID. And now we see that we're seeing economic changes, right? We're seeing inflationary pressures. We're seeing all kinds of other things. So some of this we're gonna have to depend on our economic experts in joint fiscal. So 0 to kindergarten in the report, the pre-K in there. There are some things that are not in there, but simply read the report, and then we'll have an opportunity to meet with folks, ask questions, which is a great opportunity. So that's it. So now, Alex, let's go offline, and we'll end our meeting there.